Hi, I'm Charlotte. I'm a first year PhD student at the University of Sheffield. I'm going to talk to you about my project, which is looking at management of cough and secretion problems in people with MND. So firstly, a little bit about myself and how the project came about. I'm a physiotherapist who's worked in neuromuscular disease and MND for many years, with a special interest in cough and secretion management. Myself and my colleague set up a specialist cough and secretion management clinic for people with neuromuscular disease in 2018 at the Queen Square Centre for Neuromuscular Disease. Working within this clinic has enabled me to see the unique nature and complex nature of supporting cough and secretion issues in people with MND. Over 50% of the patients that we saw in this clinic were patients with MND. This has led me to the Sheffield Institute for Translational Neuroscience, where I'm completing my PhD project looking into this. So we know that cough and secretion issues are common in people with MND, and we know they have a profound impact on quality of life and also the ability to be able to instigate other supportive treatments such as non-invasive ventilation. Research tells us, and my clinical experience has shown, that up to 70% of patients report issues with saliva or thick secretions. And patients have told us that accessing care can be difficult. So as the disease progresses and people become more physically disabled, accessing specialist care in specialist hospitals with the distances needed to transport can become much more difficult. Patients have also told us that often local community services lack the specialist knowledge and skills to treat these really complex issues such as cough and secretion management. So the aim of the project is to co-design a tool using technologies that are available to support management of cough and secretion issues in people with MND. So how will we achieve this? So the first three parts of the project are going to be trying to understand the problem and thinking about the current facilitators and barriers to good care, and also how we can harness and implement technology in this. So stage one will be a survey of healthcare professionals across the UK, and stage two will be focus groups of healthcare professionals to try and dig down a bit deeper on these issues. Part three will be interviews with people with MND and their caregivers, because we really want to get their perspective on this as well. Stage four will be using all the information we've gathered in stages 1 to 3 and working with our stakeholders to co-design a tool. We're really keen that anything that we develop here is co-designed to have the thoughts of healthcare professionals and people with MND and their caregivers in mind. Lastly, we will do a short pilot of this tool within clinical practice. So the outcome of this project will be a co-designed tool. Now, we are not sure exactly what this tool will look like at the moment, as the first 3 stages and stage 4 will come together to kind of develop this tool. Thank you very much for listening. If you have any further questions or would like any further information, my contact details, my email and my Twitter handle are on this slide. Many thanks.